do is get started. I'm going to go ahead and start the recording for everyone, and we'll go from there. So what I'm going to do is, if you are putting in the chat, just let me know if I don't see your question right away, and I'll make sure that we answer it before we finish up for today, okay? So what I want to start with first is I'm going to share my screen, and I'm going to kind of run us through the course with some of the assignments, just so everyone can take a look at what we're going through. And people who weren't able to make it, they'll be able just to view the video afterwards. And so, all right, let me get to share my screen. All right. I'm going to share. Okay. What I'm going to go into first, like I said, is going to be the 5340 course. Now, one of the things I want to make sure of, and I can't see the chat right now, so you guys can just chime in if you need to. But the first thing is making sure everybody got the course material. I did speak to a student today who said that it may not be showing up in this area here, but if you go to the left of the page when you get into your course, it should have purchased course material there. So you should be able to get it there. If it doesn't populate in this area, you can also get it through the bookstore, or we use a program in this class called SurePath. And the SurePath has everyone to do as we're going through. So you should be able to link on here as well. And it should give you an option. If you can't sign in, then you can buy the book along with the SurePath link. And so that way that you can get into it. So if anybody has any problems as we're going forward with getting the book information, please reach out to me. I'm more than happy to walk you through it and make sure that you get access to whatever you need. And I really do mean that. For most students that I've talked to, I've already told them, make sure you save my number in your phone, and you can reach out to me by phone call. You can reach out to me by text message. You can reach out to me by email, whatever preference you want. I'm pretty open with any of those. And so my SurePath and book are on back order. So our book is an ebook. So it's not going to be, it shouldn't be anything where there's a back order. It should be where you're able to just get into the book. And so how it should look is, let me see if I have this open. So it might take just a second to load. So when you go into the course and you guys are talking about the book and then the code, it should just be a code that's emailed to you. If you want a physical book, then you can get a physical book, but it should just be a code. And in the book, what should happen is that you get this code, you're going to have to register and put in your information, and then it's going to open up the SurePath piece that's here. And let's see if it gets into it for you. Okay. So it's probably not going to look identical to mine because mine is the professor's view. But so when you open it up, it should look something like this. It's going to have a home page, and then it's going to say your book. And then this is your book that's down here. It's the Jarvis book. And so it's the ebook. If you come to the course plan, and for yours, I think it just says the weeks, what's going to happen is it's going to expand. And when you go into the weeks, it's going to have which chapters we're covering per week. And then you should be able to open it to be able to get access. And so I think I opened it up under week 2 so you guys had it all. Let me see. So yeah, it'll show visible and then what the ebook looks like. And then you should just be able to click onto it and then read into the different ones. So this would be the time I'm in. So let me see what they said that's what's on back order. The bookstore is saying no. They're saying it's a card. I got mine through the class. So yeah, if you can't get it through the bookstore, then just come get it through the class. And so either way, just let me know if you can't get it, so that way I can make sure that you do get the information. So I want to make sure, because each week we're going to have a quiz. So That's the next thing to go into. So when you go into the modules, I want everybody to take a look at them and go through them. So we recreated semesters ago. And if you go into the overview, it tells you what we're covering for the week. There's a lecture that I've already put all together for everyone. So every week there's a lecture that's already pre-populated there so you can work ahead. There's PowerPoints that are put in as well. The Sure Path is where you're going to get the book, as well as that there's going to be, not this week, but in the following weeks, there's going to be simulation physicals that I want you guys to do. And I can see that they're being done or not, but what I want is for you guys to go in and do those simulations. And so that way you can walk through on how to do like a head to toe or ears, eyes, nose, and throat. And so to walk you through all of those. Then each week you're going to have the quiz. So you're going to have week 1, week 2, week 3. Each week is only going to cover what is being read in that week. So it's not going to be an accumulative, okay? So it's just covered by what's during that week. Now, the quizzes are going to be based on the book, so the Jarvis readings. There's also what we have at the very end of the course is what they call a 3P exam. And so I think most of you have probably taken that already in like pathophysiology and pharmacology. And that test is going to be an accumulative of the class through APA. And we like to make sure that students get around 70%. If you don't make 70% the first time, then that means you're going to take the test a second time. We want to try to get you as close as possible to that 70%. Are there any questions on that so far? Nope. Okay. So when we go down, so when I said you're going through, you're going to see week by week. So the overviews are going to give you an idea of what's being covered. And then you're going to have the lectures and then you're going to have the quizzes. Now, when you come down here to week 3, this is where you're going to start getting the group presentations. Now, I am going to assign those to you here probably in the next day or two. I just want to make sure I have everybody in the class before I make the assignment so we're not having to go through and change anything. So the group progress is going to be this. So it's going to be you and likely 3 or 4 other members of your classmates, okay? I'm going to put you guys together in a group. And then what you're going to do is you're going to come up with a patient. And it's just going to be a fake patient. It's not going to be a real patient. Or if you guys want to use someone that you saw in clinic, that's okay. But what it's going to be is something that we're going to be covering over the next several weeks. So it could be a patient with COPD. It could be a patient with hypertension. You're going to make up the diagnosis. You're going to give the patient information like their age, their sex, their complaint, what they're coming in for, the HPI, their diagnosis, like their history. So other diagnoses, medications, and things like that. And you're going to be giving all of that information to your classmates. Then at the very end of it, you're going to come up with 5 questions for your classmates to answer. Do not give them the diagnosis of the patient. That's the whole idea of this, right? Like you're going to come up with this patient, you're going to be presenting it, you're going to say, this is what's going on with them. What do you think it is, right? And so you're going to be like, what do you think the differential diagnoses are? What do you think the diagnosis is going to be? What's going to be the plan? How would you treat it? What would the lab show? You're going to be coming up with these questions for your other classmates to answer. When you're the presenting group, you have to answer 2 students back, okay? So to help participate with the discussion. When you are the group that, or if you're the student that's not in the group that week, you're going to answer back that group, and then you're going to do 2 other responses to other students, okay? And so that way it helps further the discussion. That's really the whole point of this, is that we need to get our thinking caps on. So we need to be coming up with not only what the diagnosis is going to be, but then what are the differential diagnoses are going to be. And so I know someone else put in there already that they're a post certificate. So that's something we do commonly in practice, is we come up with an idea of what we think something is, right? And then we come up with differential diagnoses, what we're going to be working out, and then what the actual like diagnosis ends up being, and that plan of care for the patient. And so in your SOAP notes, that's something we're going to be looking for as well when we go over that. So I'll have these posted for your groups. Come back next week and look at announcements, and you're going to see it there. Now, the only other thing in the 5340 class for the is that when you come down, it's probably going to be in, I think it's week 8 on here is you're going to have something that says a head to toe demonstration video. Think ahead on this, because what this is going to be is there's a consent sheet that is actually up at the top, a little bit above where it says the supplemental, or it's going to be the next one up. And it has the consents where you're going to be getting a patient or a family member or a friend. You know, if you're already out of clinical, I know you can't use a patient. So you're going to get them to sign the consent saying that they're allowing you to videotape them. And then you're going to do a full head to toe assessment on this person. Now the rubric is going to be present. And this is what I tell students all the time. You can print the rubric and you can put it on a clipboard. You can't stare at it the entire time, but you can refer back to it. And so as you're going through that head to toe assessment, you're going to be going through and you're going to be doing the tuning forks. You're going to be doing the Snellen chart. You're going to be doing a full neuro exam on this patient, as well as a full abdominal exam. And so I would tell you to print off the rubric and then have that with you. And so that way you can use it as you're going through so you don't miss anything. There is a kit that you can purchase in the bookstore that I think has like an otoscope, has the tuning fork and the Snellen chart. And so I would tell you to go ahead and get those items. You can use the ones that are in your job or in the clinic that you're in. You can even do this ahead of time. And so you can do it while you're in clinic. So you're not waiting till the very end. It's really up to you what you choose to do. But if you need any further guidance on it, just let me know. The one thing I will tell you is this, is if you go over 30 minutes, you're going to have a really hard time loading this video. And so the idea is if you can keep it under 30 minutes and go through the steps. If you can't, that's okay. Load it to Dropbox and then load it into the class. And then it's going to save you a lot of time trying to figure out how to load it and move it back and do it other things. The other thing you can do too is you can do a Zoom session, like a Zoom video, and have it recorded that way. There's other people who use like the Microsoft Teams. Some people use YouTube, some people use their Apple. So there's different ways to do the video. Whatever way you choose, just let me know if you're having a problem loading it and I could probably help you walk through it. Is there any questions on the head to toe? And I think most people have been through a bachelor's program, maybe through South, and they had to do something similar. But this is going to be a little bit more in depth. And so that would be something I would tell you, is that it's not just going to be like where we walk into a room and just listen to the head, nose, and chest. I mean, there's a lot of stuff into it. And so please make sure you look at the rubric so that way you're walking through it. So that's the biggest portion out of this course. So just make sure that you're going week by week through the modules. There's lots of information in the class, and I'm going to tell you that. So between the lectures, between SurePath and the book, you're going to be getting lots of information over the next 10 weeks. And I know it can be overwhelming. So just make sure, start here and just work your way down. That's what I tell everybody to do. So that way that you're not missing anything. The other thing is going to be if you're looking for any information, so the syllabus is here for you. And so if you don't want to open up the syllabus the entire way, you can also come down here and it gives you the week by week of the course summary of what it is that we're going to be doing. All of the announcements that I post are going to be underneath the announcements and it's going to come up to you. This is if there's going to be a change in assignments, if there's a group that you're being invited for, if there's something that the school wants you guys to see, you're going to see it in the announcement page. For this course particularly, I add in assessment videos that I used to see, like when we used to do grand rounds at the hospital, or ones that I've picked out online that I think really go in depth for like medical students as well as nurse practitioners and PAs. And so you'll see those as we go along. Those will also be present and that will help you with the physical assessment piece as you're like putting it together with what you're reading and then what you're doing in clinical, because some of you guys are not in a family like practice clinical. So there's going to be some things you're not going to be getting. And then even besides that, I mean, there may be things that your preceptor may not go over with you. And so I want to make sure that you're getting the most out of it. And so there's a lot I put in there for cardiovascular as well as different types of abdominal pain to help out with those assessments. So just know, be looking for them up there because that's where they're going to be at. So when we go into the 5341 course, that's going to be your clinical course. And so in that class, it's a little bit different in the assignments. The books are going to be exactly the same. So you do not have to worry about buying multiple books. It's the same book going from one to the other. I didn't want people having to spend a lot of money, so I tried to find the best assessment book that I could. And so that way you're just buying one. And so the Sure Path goes along with that in this course as well. So same concept announcements are going to be there. Look there to see if there's anything that we're putting up. A lot of the stuff I put up here. If you click at the very beginning, you're going to see Typhon. One of the things I'd say is make sure everyone has their Typhon information. You have your login, that you've logged in before you start clinical, that you know the information that you need to be collecting. And we're going to go over a little bit of that here in just a second. But Typhon is really important. Typhon at the very end of your clinical rotation, you're going to be able to take the patient mix that you've seen and all the cases that you've done, and you can actually print out a profile and submit that to places that you're going to go work or places that you're interested in going to go work, so they can see the type of client mix that you've had. The other thing that's important is that we have to send this to the board. So whatever certification board you're going to be using, this is part of the requirements that get sent as well. You need to make sure that you're putting in entries on every patient that you're seeing. The other thing that's important is that you have from the very first clinical day. So if you go on a Monday, by next Monday, you should already have those cases in. You get 7 days from your clinical visit site to put in your Typhon information. If you do not put it in that time, the school can technically make you do more hours and dismiss those cases, because there might be issues with accuracy if you're doing it at the very end of the month. So we ask to make sure that you do it within the 7 days. Other universities, it's within 48 hours. So please make sure within 7 days you have your Typhon entry stuff in, because I promise you, I will hound you. And I know Dr. Jenkins will also hound you. So please make sure that your information is in. The other thing is, as far as Typhon goes, you do not have to do SOAP notes on every patient that you see. We're going to be doing the SOAP notes in the class. So you only need to do the required pieces for the entries into Typhon to submit it and save it. After that, your SOAP notes are going to be in the clinical course. So you do not have to do SOAP notes. If you want to put notes in, that's up to you. But I promise you, there's going to be so many cases that you're putting in and so many patients that you're seeing and other things you're going to be doing. You don't want to get behind. So please don't stress yourself out and be putting in extra things you don't need to right now. Okay. All right. So that right there is Typhon. Let me go back. And down here, if you have questions, I'll be honest, sometimes I'm not the best at answering it this way, but if you put something in there, I usually do go back and look. If you do have a question that you really want answered, or if you feel like you're struggling with something, just call me. I'm pretty easy. And so you can reach out to me at any time. I am in the Pacific time zone, so I'm 3 hours after you. So even if it's like 9 o'clock where you're at, it's only 6 o'clock here. So please just know you can answer out anytime that you want. The course calendar is going to be there as well. Now, when you're going into your weekly assignments, so here is going to be your practicum and preceptor information. So here you're going to have the different things. So like a case log, you're going to be submitting that every week about how many hours you're doing. If you're not in clinical, you put a 0, you can just type it in and put 0. Your preceptor is going to be signing and initialing your case logs on this paper. Not in Typhon, but on this paper. You're going to be submitting that back to me and the other clinical instructor. And so that way we can sign you off week by week, but that's your verification to know that you're there. So you need to make sure you print that off. If you can't find it, let me know and we'll walk you through it. The other thing is that you're going to be required to do an evaluation at the end of your clinical site. And so there's one, I think, on the preceptor as well as on the site. And that your preceptor is also going to be doing an evaluation on you. And so that will be in Typhon for them to log into. The pre-practicum planning meeting is making sure that, you guys have everything set up. So you have your jacket, you have your patch, you have your stethoscope, you've talked with the place about dress attire, and that you have all the information you need before starting. Everybody should know what it is that they're going in and doing in their clinical. So for this clinical setting, you are going to be going in and learning how to do comprehensive assessments versus focus assessments. You're going to learn how to elicit a history from a patient. You're not going to be doing sutures and you're not going to be doing injections and things quite yet. You need to learn how to do those and get signed off first. For this first clinical setting, this is basically for everyone to learn how to transition from a bedside nurse into a provider and learning how to feel comfortable in talking with patients and just being comfortable in the room. So that is the idea for the first 60 hours. As soon as you get out of this class, you're going to be going into those longer clinicals where you're going to be doing a lot more. The preclinical call is something that's set up between me and you, or the other clinical instructor and you. And it's the very first call. This is to make sure that you understand what you're going to be doing in your clinical rotation, and that if you have questions, it gives you time to answer those questions or ask them. And so that way you have a good idea of what's going on before you get in there and you know what to focus on. One of the other things I'd say is here's the clinical log submission. So a lot of people are not starting clinical this week. That's okay. Just put a 0. Any week that you're not in clinical, just put 0. The biggest thing is you have to have 60 hours by the time that you finish your clinical, the clinical 10 weeks. And so you can set it up however you want as long as those hours are completed. The weekly, quarterly practicum plan here is what your clinical practicum is going to be. So are you going every Monday for 6 hours? Are you going every Monday and Wednesday for 5 hours and 4 hours? Or however you're going to be setting up your schedule, that's part of this right here. So please make sure that you guys submit that in once you have it. Now, going further down, you're going to have the preceptor call and the student call. So that is one, it doesn't have to be done by June 21st. What I tell students, since everybody's in different rotation, like different hours, is that your first week of clinical, you're going to set up a call between me, you, and your preceptor. What I'd like you to do is text me the morning of and say, hey, this is going to be my first day of clinical. I'd like to set up a call today. Here's a couple hours or a couple times that me and my preceptor have said that it works. The reason I do it that way is because there may be something that comes up in clinical, or there may be something that's going on and one time may not work. So if you give me a couple different options, we can definitely make sure that works for you. And we'll make sure we get that phone call done. So please just know that. When you come further down, so week 3 is going to be your first SOAP note. I will have underneath announcements a practice, like a previous SOAP note of what another student has done. And so that way you can see what one looks like. One of the biggest things to know in the SOAP note is that you're required to have a chief complaint. Let me see if, I don't know if I have one that I can readily pull up, but so what it's going to be is you have to make sure you have the chief complaint in your SOAP note, okay? And it's going to be something that's very short, usually like in a parenthesis, patient comes in abdomen pain, okay? Then in the HPI, you're gonna be putting in, this is a 44-year-old female that presents with upper abdominal pain to the right-hand side, or right upper quadrant pain. Notes her pain is a 5 out of 10, states it gets worse with eating food, or gets better with eating food. However, you're going to put it into your HPI. But that's usually what this is going to be here. OCARTS is a great thing that talks about, it's like a little acronym. And so it walks you through the elements of what is required in a SOAP note for HPI. I'm going to be posting that for you in announcements, so you have an understanding of what that is. And basically it just kind of walks you through, like, what's the complaint? How long have they had it for? The location, the duration, the character of it, the acuity, and so it walks you through all of that. And so you can put that in that HPI, and that gives you a full HPI. Then you're going to have the medications that the patient's taking, things that are prescribed, things that are over the counter. And then all of their past medical history information will be present there. And then you have the family history. Here you have a genogram that's going to be due. And so the genogram is kind of like a chart, and it tells like family history, like mom died of colon cancer, dad died of pancreatic cancer, or dad had diabetes, mom had hypertension. All that information will be there. And then you're going to have the personal history. This includes like smoking, drugs, alcohol, make sure all that's there. The review of systems, you have to write out the entire review of systems. You can't just put negative. And so I like to tell everybody that don't do that because you're not going to be able to. You need to list it all out. Same thing goes for the physical. is that I've had people who just put like a very, very small physical in. I want to see you write out the entire physical because that's how you're going to learn what to put into it and what needs to be there. So please don't just put like 2 things. On every single patient that I see on a daily basis and, primary care, I'll tell you, I have a full physical on a majority of it, or I at least have a half physical of, what's being addressed. And so please make sure that you have the appropriate information in there. When it comes to differential diagnosis, you need to have at least 2 or 3 because, let's say someone comes in with abdominal pain and you think that your diagnosis, nausea and vomiting. Okay. Well, what if it's appendicitis or what if it's the gallbladder? What if there's something else that's there that you may be missing because you didn't think of it as a diagnosis or something else that you're working out? So you need to make sure that you have at least 2 or 3 here in this area. The other thing is you need to make sure you're giving a rationale of why you're picking it. You need to make sure like you're kind of talking about, why would this be something that you are picking? Like you can't put, right upper quadrant pain and then put UTI. How do those correlate? Like, why would it be a UTI with upper quadrant pain? So I'm just kind of giving you an example on that. Then the next thing is going to be what the actual diagnosis is that you're working, like what is it you guys are doing? And then if there's any lab test that goes along with it or any of these other things that you're going to be doing, you fill it out. And then your rationale why. I like to know why you're picking a medication and why you're doing it, as well as if you are doing tests, why are you doing those tests? When you're in the clinical setting, you're going to see people doing things, right? Sometimes it may be the right thing. Sometimes it may be the wrong thing. If it is the wrong thing, please don't point it out to the preceptor. If there's something that's really concerning that you're seeing, let me know first, and then we'll talk about it, and then we'll figure out a way to address that with the preceptor. And so I don't want you guys to have any conflict in clinic. So you're going to have 4 of these that are due, the SOAP notes. And I think it's like week 3, week 6 or 7, and then 9. So those would be things I would tell you. The other thing is going to be, you're going to have a self-reflection that comes up as well. And that's just for you guys to talk with each other about what's going on in your clinical rotation. And kind of giving some stories to share because not everybody's going through the same rotation and may have different experiences that are happening. So, all right. Now, the next thing I want to do is to hop into Typhon real quick. So mine is going to look different than yours, just so everybody is aware. The big thing is that the information being put in should be relatively the same. So yours is going to have a different screen where it's basically going to say case logs and like entry. And I think it also has like the time log and what it is that you're putting in. And so let me get to, we'll do an individual one. So once we get into the case log, like I said, you do not have to put everything in at the same time, okay? Like, or you don't have to do SOAP notes on everyone. And let me see if this is going to pull up for me. Okay, so this is kind of how to look. All right, so it's gonna, for me, it's gonna look this way, and for you, it'll look somewhat similar. Over here, you're gonna be able to tell if it's been approved or not, okay? The next thing is if it's been approved, you won't be able to change it. I'll have it locked, so you guys won't be able to do anything with it. When it comes to the information that needs to be put in, these are the things I tell students. So it needs to have the semester, it needs to have what the course is, who your preceptor is, the clinical site, the setting type. So if it's rural, it means rural, you're in the country. If it's underserved, usually you're in a city because most cities are usually underserved. You're going to have the age of the patient, the sex of the patient, the race, what their insurance is. And this is referrals that you're placing. So like if you're going to send them to psychiatrist or mental health or social work, you're going to put the time you spent with the patient, the time that you consulted with your preceptor. So like if you guys spent 10 minutes talking about the patient, you're going to put it right there. The type of decision-making, is it going to be straightforward? So like someone with a sinus infection, or is it going to be something more complex? Someone with severe diabetes or abdominal pain, chest pain. Your participation is if you're observing, that's okay for the first day, but you should not have more than 6 hours of observation. You guys should be getting in there, seeing what's going on. and then jumping in and doing either shared or you were taking over the patients. And so make sure that you look at the participation and you put that in appropriately. You're going to put the reason for the visit. So it'll come into like a code box and you'll say chest pain or sinus pressure, sinus infection, and it'll be right there. The chief complaint. The encounter usually is the first one for you. Some people may see a repeat. And then down here, you're going to put like if you addressed any social issues or not. Sometimes you do, a lot of the times you may not. And then you're not going to be doing any skills or procedures at this time. Your diagnosis codes, there's going to be a drop box here for you to put in your diagnosis codes. CPT-10 codes are going to be procedure codes. Again, you guys aren't going to be doing procedures. So you really shouldn't have too much to put in there. And then the only thing I require as far as medications or medications that you guys are changing, patients can be on 30 medications. I don't expect you to put in all 30 medications. I expect you just to put in the ones that you're addressing during the visit, just to make that a little bit simpler. And then down here is where I was telling you, it's going to have like clinical notes. You don't have to do SOAP notes for this area, so please don't do it. If you want to type in something short so you remember the case, and that's perfectly fine. So, all right, now questions. So I'm sure people have questions. So if I can go over that with you, I'm more than happy to. So you can turn off your mic and unmic and ask. It's open for you. Any questions from anybody?
Hey, Dr. Newcomer, this is Christy. On SurePath on week 1, it looks like that one of the final lines covers like all the chapters in the book. So it really doesn't give us a defined section that we should be reading or working on that particular week.
So when you go back into SurePath, sometimes I open up the book just so everybody has it there. But when you get into it, you can just go by what is on the, like what's being covered on that first portion. So let me get into it. So it should just show chapter 1 through 4 for you. Like that should be what should be there. Are you seeing more than that on yours when you go into it?
Yeah, it'll show like chapters 1 through 21 and
like for the book piece?
Yeah, and so you're not really quite sure which assessment you're supposed to do.
Oh.
I'm not sure if anyone else is seeing that or not.
Let me take a look because you shouldn't have all of that in there. So for the first week, you're going to have chapters 1 through 4. And then for the next week, you're just going to kind of go, I think it's chapters 5, 6, and 7. And so it should be something like this, where it shouldn't show you all of it at once. Like it should be chapter 1, and that's how it should look. So that's not how.
Mine doesn't look like that.
Mine doesn't either.
Well, I might have to get with one of you then so I can see how yours is looking. So just know that the first week, this is all you're required to do. When you go into the module, it'll show you that as well, what you're required to read for that week. And so that should kind of help guide you just until we can get that fixed. So Christy, I might get with you that then. And so I can see yours. Maybe we can do a Zoom session. And so I can see.
Okay. Would you like me to see if I can pull it up and share my screen?
Yeah, I think it's going to cut me out of time on here.
Oh, okay.
If you have it up, maybe. Let's see.
Let me see real quick if I can grab it.
We're also only seeing week 1.
Yeah.
Will that be additional?
So,
Because I'm also so go ahead.
What I've done is I've on it. Talking about is I don't want you guys to get hit with so much. Open it, you're like, oh my God. So I have it where you have certain pieces that are visible at different times. So you can see here, like these will open up on 6/12. And then the other ones will open up later. And the reason I've done that is just so you don't get too much at once. Because I'll tell you, it can be overwhelming. And those are just the lessons. Like these are just additional lessons. It shouldn't affect you getting into the book to look at your chapters. These are only pieces that are like, it'll show you how to do a full assessment or documenting of a mental exam. And I will tell you, anybody who is a Psych NP or going into the Psych NP, please make sure you actually look at these. I'm a Psych NP as well. And I will tell you, I picked this specifically for this section. It is very, very good. And so the documentation of it actually is really good. Same thing for the substance abuse issue, as well as assessing the violence at home, because that's something that is becoming more progressive all the time, is that women that are being kidnapped, women that are being abused, raped at home. And so a lot of times people don't feel comfortable asking those questions. And so this is a really good chapter to look at that. So, all right. Were you able to open it?
All right. I do. If you want to let me share my screen, I can do that.
Let's see if this,
Professor, it looks like it just has two different sections, because one section has 1, 4, 3, and 30, and then the other section just has the whole book. I think it just has two different sections.
Yeah, that's what mine looks like.
Yeah, so I kind of just canceled out the whole 1 through the end of the book. And then, so I figured it was 1, 2, 3, 4, and 30.
Can you, Christy,
Because
can you
that's what
open
was in the
yours?
class.
You should be able just to.
Yeah, I've got it open, but it's not letting me. I think you've got me blocked where I can't share my screen.
Oh, okay. I like.
So share
I am.
screen.
How about now? Can you get in there?
Okay, let me check. Can you see that?
Mm-mm.
Okay, hang on. I'm trying to share, and when I hit share screen, it says host disabled participant screen sharing.
Yeah, I don't know why it's not letting me do that. It might be because I'm recording it. We'll try it again. What I'll do is maybe I'll
Okay.
share with you here in a minute. So there is a demo video for Typhon, everyone. So when you log into Typhon, it'll be up. I think it's to the right-hand side for you when you get in there. So I also have, I know I'm running out of time, but I have Dr. Jenkins on here too. Debbie, if you want to say hi, I think some of your students are on here as well. And you guys are more than welcome. If you have any questions, in any section, just to reach out to us and let us know.